Recording in progress.
Yes, hello, and good evening, everyone. Those of you who haven't met me before, my name is Dr. James Song. I'm a Malaysian but residing in the Philippines, and I'm very passionate about this Aculife because it really works. And why am I so excited? Well, today I'm going to explain to you, and those of you who are listening or tuning in for the first time, hopefully I can produce enough evidence to make you a little bit curious. Okay, so I'm gonna get started, and yeah, I don't know if you can hear me, but I hope that you do. All right. So anyway, I'm gonna keep going, and today I'm gonna add something new. So I hope you guys will enjoy this short little video that I will be sharing in a while. And it's always good to share something new, right? Because otherwise, some of you who have been following this may get a little bit bored, right? Okay, so here we go. First of all, let me explain to you about this amazing technology that we are talking about is acupuncture. And acupuncture has been around. And how long has it been around? Well, it has been around for 3,000 years. Yes, 3,000 years. Can you imagine? Something that has been around for 3,000 years. Wow, it must be pretty amazing. Now, as I present to you, I'll be presenting medical journals, to substantiate everything that I say. And here, the National Institutes of Health already explained that acupuncture has been in existence for 3,000 years. All right. And this thing that we are talking about, this little thing, is known as electroacupuncture. So what is electroacupuncture? Well, you have acupuncture with needles, and then you have strings that connects to the current that to make the needles more energetic, right? The vibration and to make it more effective. So that's what they believe. And some say that it was invented in the 1930s in China, some say in Japan, some say in Germany, but whatever it is, it's been around and it has proven to work. All right. So when we talk about acupuncture, the traditional Chinese medicine believe that our body is basically energy. And because we are energy, we have energy pathways. All right. And these energy pathways run through different organs. And if the pathways are blocked, wow, you will have a chronic disease. Okay. So the whole idea about acupuncture is to unblock these blockages. Now, to prove to you that acupuncture works and to prove to you that electroacupuncture works, I'm going to play a short video. You guys, I'm sure, are pretty much aware that whenever somebody goes for a major operation, they need to apply general anesthesia, right? To basically put you to, sleep and you don't feel anything, right? But do you know that acupuncture can also replace general anesthesia? Okay. So I'm going to play you this short video and I hope you enjoy it. Okay. Yeah, it blew my mind when I saw it, but I'm sure you will be amazed with it. Okay, so just enjoy this. All right, hope you guys can hear.
China, a young woman is having open heart surgery. But it's unlike anything you'll see in the West. She's still conscious. Because instead of a general anesthetic, this 21st century surgical team are using a 2,000-year-old method of controlling pain. Acupuncture. In the city's most advanced hospital, 21-year-old factory worker Chun Gunlian has a hole in the heart and her health is deteriorating. She's about to have open heart surgery. Even with the best medical equipment, it's a risky operation. Her chest will be cut open and her heart stopped. But Gunlian will go through all of this without a general anaesthetic. Instead, she's chosen acupuncture. Although sedated by drugs and her chest numbed, she'll be conscious throughout the whole procedure. The doctors stimulate the needles using an electrical current. As the surgeon begins, the success of the operation depends not just on his skill, but on the power of acupuncture.
Acupuncture is an effective painkiller. It's also less damaging to the body than a general anaesthetic.
It seems incredible, but Gunlian's doctors have done more than 300 similar operations. Gunlian's operation is entering the most dramatic phase. They check she's okay as they prepare to stop her heart to repair the hole. It seems amazing to me that acupuncture is even considered for such a life-threatening operation. But after 2 hours of intricate surgery, everything appears to have gone well. Remarkably, just 2 days after the operation, Gunlian is sitting up in bed, telling her sister the story. Her memories are still vivid.
I remember the doctor stuck a needle into my hand and felt my pulse. Then he put another needle in here and here near my vein. Then my whole body started to tremble. When the scalpel started to cut the bone, I could hear it all. But I didn't feel any pain, not a thing.
The speed of Gunlian's recovery is impressive. Just a week after the operation, she's ready to check out. And there's one other benefit to the acupuncture. The bill is a third of the cost of an operation with general anaesthetic. Visitors now believe that this simple needle has extraordinary powers.
Okay. Wow. So I don't know about you guys, but I'm convinced. All right. It's amazing. I should have warned you guys first, but yeah, Paul, wow, you're up early. Nice to see you, buddy. This is amazing. Guys, I'm gonna send this video all out to your Telegram, WhatsApp, and everywhere. All right, okay. Do you like this video? Yeah, again, I can send it to you. It's being compressed. It's pretty amazing. I mean, 3,000 years. So what happened? Why is it alternative? Why is it not mainstream? Well, that's a question that we can all ponder on, but I'm going to suggest to you that there is something behind the scene that is playing on us, all right? you know, when penicillin was invented, it seems like a pretty good business if you can create some kind of a drug and get people to be dependent on it. Are you with me? So these businessmen, they kind of got together and they started developing, researching more and more drugs. And therefore, they became the big pharma, and they are big and powerful. And in order to sell their drugs, they have to brainwash you. They have to tell you certain things to make you frightened. For example, like if your cholesterol is high and you don't do anything about it, you don't take the cholesterol drug, you're going to have a heart attack. So we have this COVID virus. If you don't wear the mask, you're going to get a COVID. Are you familiar, right? It's like they frighten you. They scare the hell out of you. You know what I mean? Get the picture? Yeah, I think the pandemic has really taught us something, isn't it? Right? So there's a lot of things going on out there. And if you don't, still understand what I'm trying to tell you, you go to the major hospitals and you look outside if you have the time. There'll be a lot of medical reps waiting to see the doctors. And why would these medical reps want to see these doctors? Because they want to introduce or they want to increase the sale of their drug. Am I right? So these doctors, if they push those drugs and they hit a certain quota, well, they get a lot of incentive. And some of these incentives are fantastic travel incentive. You get a picture? And most of these conventions are like a holiday. They go to a 6-star resort for a convention, all right? And I believe there is a conflict of interest when you are trying to heal someone and yet you're trying to push them to take certain drugs. This thing heals you and you don't need any more maintenance drugs. Wow. Very powerful statement, isn't it? Okay. So guys, I love you guys. I know some of you love me too. All right. I'm just speaking from my heart without fear because we are with the light. We will awaken people around the world. All right. And yeah, I could be a primary target in the months or years to come because they will not like me. They will not like me because I am taking the business out from them. But it's okay. If I were to be one day, it's okay. It's for a good cause. All right. So anyway, I hope you are having, fun, enjoying what I've said so far in the video. And let me just go on to say this. Okay, let me just go on to say, when you talk about acupuncture, electroacupuncture, there must be some scientific basis to the explanation. Otherwise, a lot of us, people like myself, my background, I'm Bachelor of Economics, Bachelor of Laws from Australia, PhDs from Sri Lanka in complementary medicine. Some of you are professionals, I know. And, a lot of us who are professionals, we like to see science, right? Black and white. We don't want just hearsay, isn't it? Okay. So being used to presenting in court before judges, I always have to produce evidence. So today, tonight, all of you are the judges. I have to persuade you. I have to give evidence, right? To convince you. Are you with me? Are we willing to role play today? Right? So I'm going to tell you and show you that there is scientific basis to electroacupuncture and acupuncture. And the first reason that I'm going to share with you is these stem cells journals. And it says this: electroacupuncture promotes central nervous system dependent release of mesenchymal stem cells. Good thing of being a lawyer and attorney is that we play with words to make a living. We can dissect them, we can chop it up, we can add whatever, right? But words are words. So if you look at electroacupuncture promotes You know it's good. Promotes, right? Promotes what? Well, central nervous system dependent. That's like one phrase. Release. Release of what? Mesenchymal stem cells. Guys, that's huge. Because what are stem cells? And what are mesenchymal stem cells? Well, there are many types of stem cells, pluripotent stem cells from the skin and from placenta and from here and there, but there is this type called mesenchymal stem cells. Essentially, you find them, you'll be surprised, in your fat. A bit like liposuction, you know? You suck out the fat, yellowish, right? Ugly, yellowish, yeah, on your belly. And then you separate the stem cells. And the rest you discard and you throw away. And the stem cells that you separate, you put it under very cold. I can't remember. It's negative 60, 70 degrees. Very cold, all right? You freeze it. And then you kind of like have to go back to the hospital. This is stem cells therapy I'm talking about. And then they will inject these stem cells each time you go there, maybe 4 or 5 sessions, into your damaged organs. Are you with me? The reason they do that, or the reason they did that, is because they want these stem cells from your body to go to the specific organ and becomes that organ's cells. So from undifferentiated or dormant, when it goes to a specific organ, it becomes differentiated. So it becomes liver cells, kidney cells, you name it, all right? So that's why stem cells therapy is amazing, but it's very expensive, okay? So in the Philippines, we talk about, you know, wala pera means no money. So no money, you die now, right? No. Now there is an alternative. This little, small, but terrible, right, machine, electro acupuncture, can also, okay, promote. Remember the word electro acupuncture, promote what? Release of mesenchymal stem cells. Guys, that's a very, very important point, because your stem cells can repair and replace your damaged cells. Are you with me? All right, thumbs up, all right? So let's move on. That's point number 1. And now point number 2. Point number 2. Nature. Nature, to some, and you can go Wikipedia, Nature is the #1 medical journal for doctors, okay? And this is what he has to say. Electroacupuncture activates neurons to switch off inflammation. It activates your neurons to switch off the inflammation that's causing all the pain in your body, right? So it switches off inflammation. And guys, some of you already know, chronic, prolonged inflammation will lead to chronic diseases. In fact, a lot of it, okay? So if you can get rid of inflammation, well, that's the first step to healing, okay? That's the first step to healing. You just get rid of that inflammation and you're on your way in the right direction, okay? So guys, this is huge. And this is nature.com. Wow. How more powerful can you get, right? In terms of authority, isn't it? And it's like if I'm presenting before the judge, wow, this is the All England report, or I don't know, you know, I'm from the British, not the American side. Sorry, I can only speak about that. So it's like I have the best precedent to present. And moving on. Point number 3. This is National Institutes of Health. And it says here, acupuncture enhances generation of nitric oxide and increases local circulation. What is this nitric oxide? Well, there's this big company called Kayani, and they did so well because of their product, which is to produce, right, when you consume their supplement, nitric oxide. And nitric oxide will enhance your circulatory system. And when your circulatory system is enhanced, it means it can carry the nutrients to the cells. Wow, that is so powerful, isn't it, right? So that is point number 3. And now we are talking about acupuncture that can do the same. All right. Acupuncture can what? Generate nitric oxide. All right, guys. Point number 4. Point number 4 is this. And this is again PubMed, NIH. Look at the date. 2024 March 27. Very current, very recent, right? And it says this: acupuncture and its ability to restore and maintain immune homeostasis. We have our immune system, guys, but if it is overreactive, it's going to harm you. They call it autoimmune diseases. That means your body is attacking itself. Wow, right? Now, if your immune system is low, you're gonna get the opposite end of the, different kinds of diseases, essentially cancer, right? So you want to balance it so that your immune system can work efficiently, okay? And I've highlighted at the bottom, and on the next page, this is where we can read together. Fortunately, evidence suggests that acupuncture can bidirectionally regulate the immune system to maintain immune homeostasis. In cases of immunosuppressive diseases, that means when it's not working that well, you will have cancer. Acupuncture has an enhancing effect on immunity. On the opposite side, conversely, in autoimmune diseases, that means the body attacking itself and your immune system is like gone a little bit crazy, right? Overreactive. You may have rheumatoid arthritis, and I may add lupus and so on. Acupuncture has been observed to have an immunosuppressive effect. Wow, marvelous. This thing can balance your immune system to reach homeostasis. Guys, these are 4 very, very important reasons, right? I'll go on to number 5. And before I do that, let me now just go and say a few more things about this product. This product is a medical device. And medical device is supposed to what? Heal people. Heal people from what? Diseases. And these are some of them. And of course, the list is just far too numerous to say it out. But you know what, guys? If something has been around for 3,000 years, right? If something has been around for 3,000 years, you can be rest assured that it works, right? 3,000 years, guys. It's basically A to Z, right? Or A to Z in terms of diseases, okay? So it is amazing. Now, moving on. This is how it looks like in a box. And I know some of you probably love the color, Louis Vuitton, right? And everything is inside, and I'll dissect what's inside and show you. So here you have this wonderful US FDA registered medical device, okay, with a 2-year warranty from Taiwan. And before I go on, like anything else, we always exclude a certain classes of people because we don't want complication. Number 1 is you're forbidden if you are a pacemaker user, because a pacemaker is electronic and we don't want this gadget to be blamed for the malfunction of their pacemaker, equipment. And if you're pregnant, as you know, pregnancy can be so many things that can happen, right? And if they use our eye dog and the baby comes out to be perfect, they're not going to say it's because of the eye dog, right? But if the baby comes out and there is a problem, they are going to blame this. So please, if you're pregnant, I'm sorry, this is not for you, okay? Children under 3 years of age, as you know, infants, there could be many, many complications because their organs are not fully developed. And therefore, if you're less than 3 years old or your children are less than 3 years old, do not use. Patient with malignant tumors. Now, this is a kind of a controversial thing, I mean, why can't this be used to cure cancer, right? The thing is this: if you have any devices or medical devices that you claim to be able to cure cancer, wow, It's very sensitive, guys. You submit it to the FDA of whichever country you belong to, right? Do you think it will be approved? It's a very sensitive thing, okay? So, when this was submitted to the FDA in Taiwan and many FDAs around the world, they didn't claim this to be a cancer curing device because it's just too sensitive. You know what I mean? So that's why we have to put this exclusion, okay? Patient with malignant tumors, okay, do not use. But it's up to you, right? Patient with hemorrhagic tendencies, patient with tuberculosis, and chronic alcoholic. Moving on. Now, this is the chart, right? This is the palm, the front, and this is the back. Okay, let me now go back to the palm. All your points can be found, of your organs can be found on your left hand as well as your right hand, okay? We choose the left hand because, yeah, left hand is closer to the heart, right? It makes sense, isn't it? So you can just use this pointy little thing, okay? Let me just kind of show you how you use it. You connect this to the device, and by the way, you can use the 3 AAA batteries, or you can use the power bank, or you can plug it onto your socket at home. Wow. So it's portable if you need it. And this one, it doesn't pierce the skin. You just touch the skin. You just touch the skin, all right? When you touch the skin, there'll be 3 things that may happen. Number 1, you don't feel anything. Number 2, you feel vibration on that point. Number 3, ow! In Tagalog, aray, you know? It's not gonna kill you, but you know, like that kind of sensation. So these 3 sensations, let me explain. Let me explain. When you touch a particular point, so like I said, there are many points, your heart point, your pancreas, your diabetic, your prostate. When you touch any of these points and you don't feel anything, means there is no blockage. So the current will just go through. It doesn't bounce back. So you don't feel anything. But if there is some blockage and you touch that point, it will bounce back and you feel vibration because there is some. That means the disease is onset, okay? But if there is a big kind of blockage, right, and you touch it, a lot will be bounced back. And therefore, all right, okay. So, yeah, I'm sure you guys in Canada and US, you know what I mean, and also in the Philippines, right? Those of you with devices, and even in Malaysia, it's just so accurate. It is unbelievably accurate. It will tell you what you know, your conditions right now. It will also tell you what you do not know of your situation right now. Isn't it amazing? And I always believe prevention is better than cure. Right, guys? So this is really an amazing device because it can diagnose and it can heal. So it's 2 in 1. Actually, there's 3. There's a third one. So it can diagnose and it can heal you. How do you know you get healed? Well, there is level 1 to level 15. You start with level 1 or 2 and you move your way up, okay? As you unblock the meridians on specific organs, you'll be able to introduce higher amount of current. So you move up the level. Are you with me? That means you're healing. The blockages are slowly reduced, all right? So you're able to move up. Because from day 1, when you had the blockage, and you try going even like 5 or 6 or whatever, you're gonna jump to the roof, all right? So you're not able to do that. But as you do a few sessions, you'll find that it will diminish. Are you with me? So you know that you are getting better. But guys, if you are healthy and you know it, because why? You feel differently, isn't it? When you feel better and then energized, suddenly bursts of energy, because a sick person has very low energy. Am I right? And then, I don't know, if you have a pain, sciatica or arthritic pain or any kind of pain, and the pain disappears, you know you're healed, right? And then your sugar level, right? I mean, there are many things that tells you that you are healed. Or you have a prostate problem, and your frequency in waking up in the middle of the night becomes lesser and lesser and lesser. Or you have insomnia, and suddenly you can sleep like a baby, okay? Or I don't know, constipation, and suddenly you go to the toilet or CR and you have a BOM. Right? I don't know. There are many, and I'm interviewing people. I'm collecting all the testimonies for you guys. And yeah, by the way, look at the link tree below in the chat group. I've already copy pasted there. You can copy and you can open up the link tree, and there are many videos all made for you by yours truly. All right, so let me continue. Okay, and the fifth point, right, why this device is so amazing is because it has the clips here. And the clips here is called the transcutaneous auricular vagus nerve stimulator. So big words again. Transcutaneous is anything that runs on the skin. Auricular means anything that is dealing with the ears. And vagus nerve stimulator. So why do we need to stimulate the vagus nerve? This is the vagus nerve, guys. Look at it. All over your body. Because vagus nerve comprises of 80,000 nerves. Guys, 80,000 nerves. Vagus nerves should be in the plural with an S, isn't it? Not vagus nerve, singular. It should be vagus nerves because it's 80,000 nerves. So what do these 80,000 nerves do? This is WebMD. We all know WebMD, right? And this is what he has to say. The vagus nerve is an integral part of your autonomic nervous system. This part of your nervous system controls the things your body does without conscious input, such as breathing, digesting food, sweating, heartbeat, right? Do you have to tell your heart how to beat, or your heart knows how to beat? Hello? So this is your autonomic nervous system, and it's controlled by your vagus nerve. But what happens when your vagus nerve is damaged? I'll come to that in a short while, all right? Why I believe that our vagus nerve has been damaged severely. Okay, let me move on first. So what does the vagus nerve do? Well, your heart rate, it regulates your heart rate and taste, speech, skin sensations, muscle sensations, immune response, respiratory rate, blood pressure, mucus production, saliva production, digestion, frequency of urination, mood, etc., etc. Guys, almost anything and everything. And what are the symptoms? Well, because there are 80,000 nerves, if any of the symptom were to arise, you probably will not blame it on the vagus nerve. You probably blame it on that organ or around that organ. All right, let me just highlight to you what are some of the symptoms. Acid reflux, abdominal pain, bloating, lack of gag reflex, difficulty swallowing, dizziness. I mean, come on, guys, dizziness can be anything and everything, right? So you probably won't blame it on vagus nerve. Fainting, hoarse voice, wheezing, unexplained weight loss, loss of appetite, feeling full after eating very little food, nausea, vomiting, chronic mood issue or disorders. Now, they're also looking at the effect on mental health, chronic headaches, and even Alzheimer. There you go. The vagus nerve can be anything and everything. And the last thing that the doctors will suspect is your vagus nerve. Maybe they should be looking at the vagus nerve as the number one in terms of their, they have a checklist, right? Nerve, right? When you go to the hospital, and then you know what? They cannot find anything wrong with you, but you still have the problem, and you end up paying the bill. It's such a crazy. If you're not insured, God bless you, right? So that is our medical system today. In fact, when you check into the hospital, the first thing they ask you is, do you have a medical card? Do you have insurance? Or it's like, I don't know how to say. If you have a medical card or you have an insurance, they're gonna like go from A to Z in what they are supposed to. Wow, guys, I don't know. A lot has changed, right? In the medical world, a lot has changed. And they won't like me for telling you all these things. Okay? But you need to know. You need to know. Now, before I go on, what can TAVNS do? It can improve your memory. Wow. And another one, TAVNS improve human working memory performance under sleep deprivation stress. If these ear clips can improve your memory, you know what's the application of that I can think of immediately? How many people you know, elderly people, who have dementia? It's a lot, right? Isn't it sad when your own mother doesn't know it's you? I'll do anything, right? Guys, get her every day 1 hour. Because here the science is already telling you that it can improve your memory. You see, what happens with this vagus nerve thing is like, you know, radio, you have AM, FM, your cells are not communicating. Okay? They're not at the same frequency. Something is wrong, something is clogged. And what we are trying to do is to stimulate it so that it becomes healthy again, that it can communicate. Simple as that. But they probably don't want you to know. Okay, let's move on. Now, vagus nerve inflammation contributes to a condition called dysautonomia in COVID-19. Just remember the word dysautonomia. So now we are blaming on the COVID-19 virus. Dysautonomia means it is a nervous system disorder that disrupts autonomic body processes. Wow. These are automatic functions like your blood pressure and heart rate. Okay? Having dysautonomia means these functions don't work properly, causing disruptive symptoms. Guys, after the pandemic, how many of your friends and loved ones, including yourself, may have a rapid heartbeat? Hello? Right? How many of you or people you know who suddenly, out of the blues, they are hypertensive, their blood pressure shoots up? Hello? How many people you know who suddenly have a stroke after the pandemic or during the pandemic? You know what I mean, guys? So the first blame is on the COVID-19. Okay, see the joint study and they have proven the correlation. Okay, here they talk about a hallmark of fatal SARS-CoV-2 infection or COVID-19 is cytokine storm. Just remember the phrase, cytokine storm. Okay, I'll explain. Cytokines are so essential to your immune system. So cytokines per se is good, but too much is no good, all right? Okay, so it is essential to your immune system that they play a role in most conditions and diseases that may affect you. Typically, cytokines help keep you infection-free. If your immune system releases too many cytokines, that's where the headache comes in. In response to an infection or treatment, like immunotherapy, you may develop cytokine release syndrome, also called a cytokine storm. So, cytokine storm is no good. All right. Now, when you have cytokine storm, what may happen is this. Too much inflammation can damage tissue and lead to diseases and conditions, including, okay, non-exhaustive, it can be others, including autoimmune diseases, metabolic disorders, cancer, sepsis. Guys, these are serious. Okay? If something happens to your vagus nerve because of dysautonomia as a result of an increase in your cytokine called the cytokine storm, all these problems will happen. And can we do anything about it? Of course we can, right? Even Forbes has already concluded, right? New insights into long COVID point to damage to the vagus nerve. So we blame it on COVID-19. How many people had the infection? Here it says around half the world's population. Would you agree with me? Maybe more than half? Who cares, right? Billions. Now, that's only the COVID-19 virus. What about this? I had 2 shots of AstraZeneca, and that stupid company pulled out their drug in the marketplace, all right, recently, and they say that they pull out their vaccine because there are other better brands out there. But in the court document, because they are being sued, in their court document, it was stated that there are side effects. I had 2 shots of AstraZeneca. I don't know about you guys. And the 3rd shot that I had is Pfizer. If I didn't have those shots, I cannot travel, I cannot fly, I cannot enter restaurants. Are you with me? I had no choice, but I had to get the 3 shots. Wow. My deepest regret. Guys, I don't know about you, but I had 3 shots. What am I going to do about it? Well, let me tell you what I'm doing every day without fail. I'm trying to reverse it. Are you with me? Can you do something about it? Help yourself, all right? It's pretty amazing, I tell you. And this is already scientifically proven because, guys, this is a vagus nerve stimulator, all right? And this particular product has been featured in Nature for carpal tunnel syndrome using this device, right? The acupuncture as well as the ear clip. Transcutaneous auricular vagus nerve stimulator. I'm not making this up. I have to prove to you. You are my judges, right? So guys, do something for yourself. Do something for your loved ones. We have the power and ability to heal ourselves using this. The natural way. It doesn't always have to be on maintenance drugs or being cut up. Now, this technology is from Taiwan. The company established in 1999. Okay, they have 2 factories and building a 3rd one, and they're going for public listing. So it's a big company. Okay, and they have more than 1 medical devices. I'm going to share with you another one in a short while. And this is the owner, the guy on the left, not the guy on the right. His name is Terry Chiang. He's 63 years old, and he's a very humble, caring person. Okay, so I was drawn to that. And he only has one mission, to help people with this product. And I like that. Okay, and he is already, well, I guess, made it in life, but yet, let me tell you, I interviewed him and I asked him, I said, what made you register this with the US FDA? You are from Taiwan, right? And he said, when they first started this, which is a thicker version, this is the latest model, they started talking to doctors. And the problem is, where every time they talk to doctors and they say they have this wonderful device that can diagnose and treat people, guess what? The doctors laugh and say, if your device can do that, what about us? We're jobless, right? So they mocked him and they laughed at him, they ridiculed him, and then he said, if I can get this device approved by the US FDA, I can convince the world. You know how much it took him and how long it took him? 6.5 years and almost 2 million US dollars. How many of you would do that? Assuming you have the $2 million, how many of you would do that? Let's be honest, guys. This guy did it. He spent $2 million, 6.5 years, and he got it done for all of us, right? For himself, for everyone, for humanity. Isn't it amazing? Okay. And we are the only electro acupuncture medical device registered with the US FDA. Wow. And this is a wow, because of that, they have many registrations, starting off with Taiwan, okay, medical device, and then China, because it's the home of acupuncture, right? So it's also a medical device in China. USA, the one that I talked about. In fact, they have two, the old version and the new version, both registered. Korea, Japan, ISO 13485 from the UK. Now, ISO, as we all know, we have ISO 9001, 9002, and many categories, right? ISO 13485 is actually a category for medical devices. And if it is safe and they prove it, they will issue the certification to you. And this device has the ISO 13485. So you can be rest assured that it's very safe, okay? And not only that, Malaysia, okay, is registered as a medical device. Thailand, Indonesia, Russia, Australia, and Germany. Even WHO endorses this device. Guys, isn't it amazing? Wow, I've never sold medical devices before, and this is the first one. And already I'm so blessed because the first one that I endorse and promote has so many certifications. And it works. It works, it works, it works because, guys, I have seen it with my own eyes. And these are some of the people. You please copy, paste it somewhere, the link tree, and watch these videos yourself. Okay? A lot of testimonies. Okay? And I want to play this for you. Very short one. It's my good friend, TY. He's the advisor to my golf course that I played in. And the link tree is not in the chat, Doc. Oh, really? I already posted it. There you go. It's here. It is in the chat. All right, I pasted it again and shared again. I hope it's... Oh, okay. Sorry. Yeah. I know now. It has to be for everyone, okay? I was replying to someone, everyone in the meeting. Yeah, thank you so much. All right, now it's for everyone. Okay, it's in the chat now, guys. Sorry, I wasn't looking properly. And this TY, he had problem with sleeping. And when I was talking to him in the golf club after our game, and he was just testing on the ear clips for 30 minutes. And listen to what he had to say, okay? Listen to what he had to say. So yesterday you used it for more than half an hour?
Yeah, 30 minutes maybe.
On the ear clips, right?
Yeah.
On the ear clips.
And then I slept 7 hours, 45 minutes.
Wow, you had a good sleep last night, huh? Amazing. You know, just now I was in the mall and I was meeting a lot of people, and there's one lady, she told me that she would sleep around 9 a.m., but she would usually wake up around 12 to pee, okay? And then she will also wake up at 3 to pray. But she did the ear clip thing for 30 minutes, And on that night, she slept at 9 and she woke up at 5 a.m. Wow. And it was like really. But anyway, it's not new already, guys. I've heard it so many already. Okay, I've heard it so many. Just with the ear clips alone, and they all slept like a baby. Okay, and it's just so amazing, and I'm just so happy whenever I hear people sharing their stories to me, and there are more. So yes, there are more. And this kind doctor also, he had his own problem. Okay, and let's hear him out. Okay, hello, Dr. Louis. Yeah, before using this one, this ear clip, yeah, you were using it for 30 minutes.
Yes.
Tell us your problem before and after.
Sir, before using this machine, I have vertigo. I can hear a wheezing sound, and then I think there's a clog in my ear. But after 30 minutes of using this device, now it's very clear. There's no noise sound.
Wow.
It became very
30 minutes, diba?
Only 30 minutes.
30
yes, only
minutes.
30 minutes.
Amazing.
It's very clear now.
Wow. So every home should need one, huh?
Yes, it's a guarantee that they have to use this machine. It's very good.
Okay, thank you, sir. Wow. Okay, let's move on. This is an amazing one. You guys have to hear this. Okay, Tita Maya from Davao. So, for a longest time, you have problem with your heart.
Yes.
And why do you say you have problem with your heart? How did you know?
I have the symptom. My hand and the left side is always numb. Yes, and sometimes I have
Tired, breathless?
Oh yes, breathless, short breathing.
Yeah.
Yes, I cannot walk so long
Yeah.
because I feel my chest pain.
Yeah.
Okay.
And then you receive this device.
Yes,
Can you show this device?
yes,
Yeah.
I showed
No,
you
you
the
don't. You
device.
received the device.
Yes, when I received the device.
And then you started
I-
promoting to your sister-in-law.
Yes, my
And then she wanted proof
yes.
that you have recovered after using this device.
Yes.
Am I right?
All the pain in my hands, I had treatment, 5
Yeah.
minutes, 10 minutes, all the pain.
Okay, so much
For
pain.
yes, so much pain. Then
You
I
use
said
it-
that I'm very grounded.
You use it for 2 months,
Yes, almost 2 months treatment.
but still she doesn't believe. So she
Yes.
pay for your medical bill to go and do
Yes.
some tests.
So I
what
go-
test did you do?
I go to the cardiologist. Then my heart, the result is normal.
Wow. And
Yes.
what else did you test?
Then the cardiologist give me another laboratory, all the laboratories, this one.
Also,
Also all negative.
so
Yes,
and
all
your
normal.
sister-in-law is where, in Philippines or in US or
In
where?
US.
So
I
she paid for all that just to see the
yes,
proof.
she sent me outright money for my laboratories.
Wow, amazing.
To be
So
sure,
now,
to be sure.
now
To be
she's
sure, this morning, I go to the laboratory, then before coming here, I go to my doctor, then he read all the result. It's all negative.
Wow.
Thank you, Lord.
Congratulations and thank you Aculife.
Thank you, Aculife, for the amazing medical device.
Thank you. Amazing, right? I mean, it just goes on and on. I mean, I wouldn't want to.
Yes.
You can watch yourself. Right? Okay. And this one is about constipation. There's this constipation point that, yeah, this lady was so descriptive of what happened to her. Just 2 sessions on the same day. This is a blurry vision. And, yeah, it goes on. I've had meetings already, 2 in Davao, Baguio. And every time we do the meeting, we will do a diagnostic, all right? And let you know, this is how we do it. Everywhere, everywhere. Okay. So that's all about this. Now I'm going to talk to you and introduce to you, maybe in 10 minutes, about Aculife, right? Another product from Aculife, which is the D178. And this is how it looks like. Okay, this is how it looks like. And just like any product and the earlier one, there are exclusions I have to highlight to you. People who use pacemakers or electronic heart-lung devices are not allowed to do it. People with foreign metal objects in the body, that means it includes stents, all right, heart problems or stents in your body. People with malignant tumors, like I say, it wasn't registered as a FDA cancer-curing medical device. People who have not fully recovered from surgery, pregnant women, children under 3 years old. Now, this is how it looks like in a box, okay? And this is how it looks like when you set it up. So 2 people can enjoy at the same time, 2 people side by side. So one person will step on it, the other person will sit on it, okay? And what does it do? It's a Japan technology made in Taiwan. And guys, you would agree with me. Taiwan factory quality technology is pretty amazing, isn't it? That's why for these 2 products, they give you a 2-year warranty. 2-year warranty, okay? And what the D178 does is that it generates negative ion into your body, okay? It generates negative ion and it enters your body, and we can prove it. First of all, why do we need negative ion? Look at us. We are living in condos. We are having rubber shoes, all like, you know, we are not grounded. So we don't get the negative ions intended for us under the natural environment, right? When you go to the beach, you go to the waterfall, you go to the garden, grass, whatever you walk, you know, barefooted. We don't do that anymore. So we are not grounded. We don't have negative ions entering our body. Therefore, we need help. So why do we need negative ions? Okay, I'll come to that in a short while. But essentially, it has to do with our blood pH. Our blood pH, and all medical doctors agree, it should be between 7.35 to 7.45. Are you with me? You can Google it. That is the pH of the blood for an optimal healthy person. 7.35 to 7.45. Okay, but we don't have that. And why we don't have that? Because of the environment, the toxic, and guess what? Our emotional stresses. Our emotional stresses is also depleting our energy, and we are not having the 7.35 to 7.45. I'll come and explain about that in a short while, because pH can also be measured in millivolts, all right? I'll come to that in a short while. Now, so how do you know that you have negative ion in your body? 3 ways. You use a negative ion tester, so you can see the reading without touching your body. It's negative 9,000, number 1. But the negative ion tester is expensive. It's about $800, right? What if you don't have that? Well, you can have tissue papers, and then your hand is negative, right? And the tissue paper is positive, it's going to stand. Okay? So that's another way of doing that. And the third way is you have this LED light, you know, and you ground it, it will light up. So I'm going to show you this short video of how it was done. Okay? Enjoy it. Isn't it amazing? Okay. Now, let me now spend 2 minutes or so to explain to you that pH can also be measured in millivolts. But in order to do that, I have to show you this website, okay? Because this website will prove to us that what I'm saying is actually real, and this is what it shows us, okay? So this is the website, that pH, potential hydrogen pH versus millivolts, okay? So as you can see from the chart, pH voltage 0 is positive 400 millivolts. 7 pH is neutral, is 0. 14 pH, which is alkaline, is negative 400. So why positive, negative? Negative means you donate electron. Positive means you're a scavenger, you steal electron. So donate is better than to steal. Am I right, guys? Okay, that's what we know about neutralizing free radicals. So if you are talking about 7.35 to 7.45, let's take a closer look. Let's take a closer look. Between 7 and 8 pH, you have 8 pH is 57.14, negative 57.14. You do the math, okay? 7.35 to 7.45 works out to be around negative 20 millivolts to negative 25 millivolts, okay? Now, that is like battery in our body. Our cells are batteries, and to store the battery in the mitochondria, you have the ATP, as we remember in our biology days, right? The ATP. So all is good when your millivolt is negative 20 to negative 25. But what if it is not? What if it is lower? That's the problem, right? So when it is healthy, you can get the oxygen to the cells, no issues. But when it goes down to positive millivolt, it becomes acidic pH. That's when you start developing tumor. Are you with me? I don't make this up. Cancer patients have alkaline blood or acidic blood. Hello? Go Google, go and check it out yourself. Okay? Now, when you have positive millivolts, means you are scavenging, right? And at the same time, there's not enough oxygen going into your cells. And when you don't have enough oxygen, wow, malignant tumor, right? Cancer, it is known as anaerobic. Anaerobic, and it didn't come from me. It came from a 1931 Nobel Prize winner by the name of Dr. Otto Warburg. Have you heard of him? 1931, go Google, Otto Warburg. He won the Nobel Prize basically by saying, to sum it up, cancer cells are anaerobic cells. That means they don't like oxygen. So to treat or get rid of cancer, you just give them more oxygen. Are you with me? But, you know, when more people do that way, then no one will go for chemotherapy, right? Or radiotherapy and so on. Do you know what is the success rate of chemotherapy, by the way? It's alarmingly low, very low. If you know, you probably will not go for chemotherapy. Okay? That's why at the end of all this, I tell you what, those guys will probably hate me. Yeah, they will. But it's okay. I'm on a mission here. I'm on a mission to wake you guys up. Okay? It's okay. Because at the end of the day, everyone has the right to heal themselves. And you can do that. You can, and you should do that, right? Imagine, I have a good friend. He plays golf with me, all right? At 40 plus, not even hitting 50, he had a triple bypass. Wow. That was a year ago. And when he had a triple bypass, if it was so imminent, the blockage is so bad, it should have been done immediately. Am I right? No, it was scheduled 1 month later because the heart surgeon is so popular, right? He doesn't have a schedule. No, guys, if somebody is triple blockages, right? It's so severe. Hey, you do it on the next day, am I right? Right? You know, why 1 month later? The fact that it is scheduled 1 month later tells me that it is not imminent. Maybe the blockage is not that bad, right? So, you know, but unfortunately, yeah, it's one of the best. Paid a lot of money. And you know how many medication he's on right now in one day? 11 different pills. 11. Even while playing golf, he had to swallow some of them. I'm like, wow, my dear brother, my dear friend, what's going to happen to your kidneys in a few years' time? 11. Even my 10 fingers cannot count. I need an extra finger, 11. Is that a lot, guys? That's too much. That's too many. 11. But brainwash. He will only believe what he wants to believe. Are you with me? And there are many people like that. There are many people like that. You see? So I feel sorry for him. I feel sad for him, actually, really, you know. But that's what happened. That's the reality of life. So guys, moving on, this pH thing, right? Because of coffee, or the acidic diet, or the toxic, or the emotional stresses, our pH is like going to the acidic side, right? So why don't we reverse it back in the right direction to pH 7.35 to 7.45? When you reverse it back to 7.35 to 7.45 in your blood pH, everything will be reversed. Right, guys? Everything will be reversed. You know why? Because when your battery pack is optimal, is working fine, it can get the oxygen. When it can get the oxygen in your blood, it goes to your cells. Your cancer cells don't like. Are you with me? Okay, let me show you. Let me show you guys. I don't make this up, okay? It's just amazing that I have to tell you and share this with you so that if ever you have people, and this is my opinion, guys, okay? Because the companies D178, I don't represent them, I'm independent. I'm just telling you my scientific and you know, my own reasoning, and you believe what you want to believe, okay? Because they register in Taiwan, not as a cancer curing device. But let me tell you what happened in Taiwan. This machine has been around for 10 years. And they have more than 100 wellness centers in Taiwan alone. And in Malaysia, in Puchong, they have one. Because one Malaysian doctor took it there and registered it there. Okay? And let me show you. Let me show you. And I tell you, you will be blown away. Look at this. These are some of the wellness centers in Taiwan. Okay? And there are many more. And these are some of the newspaper cuttings from Malaysia. Guys, look at this. Breast cancer gone within 16 days. I don't make this up. I don't make this up. If you know of someone who has cancer or some kind of chronic diseases right now, can you help them? I believe you can. Because the alternative, which is chemotherapy, the success rate is very, very low. You go find out, okay? And it is my mission in life to help save whoever is out there who will be attracted to this Zoom, whoever is out there who will be attracted to all of us, we are the link to facilitate and to help them. At least we can give them hope. And look at the science behind it. In the brochure that comes in the box, right? I have another unit just delivered. I tell you, inside there, the brochure says this button is to increase the blood pH to alkaline. The brochure says that. If it doesn't do that, the brochure cannot write that. And it's been around for 10 years. Are you with me, guys? So if you subscribe to my argument that by converting the polarity from going acidic to alkaline, restoring your blood pH, balancing your blood pH to its optimized position, it's going to overall heal your body. Not just cancer, many things as well. Okay, so thank you so much. It's been a bit long, I know. Yes, I'm in the mood because there are so many of you, and thank you so much for your patience. And all the very best to you. And this is a Q&A time, so you can unmute yourself and ask me anything in relation to these two products. Thank you.
Recording stopped.
All right. Hope you enjoyed that, guys. Okay, let's see. Okay, any questions, anyone?